Hi there, I'm Dr. Albert Chung and welcome to your friendly proctologist. In this space and this channel we discuss your bottom end health, and I hope you can relate or learn a thing or two. In this video we want to discuss more about anal fissure treatment and specifically surgical treatments. Again, what I want to emphasize here is anal fissures, in my opinion, can be healed without surgery 95 to 98% of the time, and that's my track record. I have not taken anyone for surgery in 5 years, okay? That's how long it's been taking me to perfect this system that I've developed, but believe me, I know how to do the procedure, but I have not needed to do it. And it's been truly inspiring to see when patients have seen 3 or 4 other doctors in multiple different specialties, they come to me as a last resort and they find out that what they've been recommended from other doctors for surgery, they didn't have to do it all. And let me share a little bit about surgery and what that's about for your own information. The first procedure which I want to explain to you is Botox injection. This is a surgical procedure because I think it's humanely done in an operating room. The Botox, which is a medication which is the same as what people use to inject in their face, is the same that we use to inject into your anal muscle. And in my opinion, where I believe it works the best is it's injected into the internal anal muscle. The internal anal muscle is very famous in these videos, but it's the main culprit here, like I said, because that fissure is in there with the death grip around it. So paralyze that muscle with this medication, and then you can not allow that muscle to squeeze. Blood flow can get to the fissure wound and heal it, right? Why can't it be done in the office? Well, it's not that it can't. In my opinion, I've tried on several patients because they just didn't want to go to the surgery room, but they could not take it in terms of the pain. It's pretty severe. Even a scratch or anal fissure is painful. Imagine using a needle to get this medication in. It's just not humane at all, in my opinion. And so that is one surgical option. That procedure works very well, and for people that don't want a permanent change in their anal muscles, and it's an agent that wears off in about 3 months, it can be a good trial for someone, and it's a good option. And this is something I certainly offer to people as a potential for treatment of their fissure. What's number 2? The number 2 is actually called an internal partial sphincterotomy. So internal for the internal anal muscle, internal sphincter, and then partial meaning because it's only a portion, or usually about a centimeter or less, that the sphincter muscle is cut. And that's what the sphincterotomy means, is cutting a small portion of the internal anal muscle. That sounds barbaric, doesn't it? Well, if you think about it literally, yeah, you're cutting somebody's muscle, and it's a muscle that's pretty important. I mean, it holds stool in, right? It's a big valve. And that is one concern that everyone should talk to their physician about. Because this is a permanent change in your anal muscles, it better be done for good reasons, right? And so that's why I believe this surgery is a last resort. You go to the surgery room, the surgeon finds that internal muscle, and actually will cut a portion of it. And so what that does is that tightened band, of anal muscle becomes split. The surgeon will actually literally cut it. And that portion that is cut usually contains the length of the fissure. And when that's done, now that internal muscle can't contract as well as it used to, right? Because it's split, it's cut open. Whereas before, when it was connected, it was able to squeeze hard, but it's open now, so it doesn't have that same action. Now the blood flow can get to that fissure easier and then heal it. So that discussion about incontinence, like I was referring to before, is extremely important, because people need to know that we're not talking about just incontinence immediately after the surgery. We're talking about even 40 years from now. What are the risks of that happening? And that's something that I believe surgeons have different answers for, and I'll leave you to discuss that either with someone like myself or with the surgeon. Though that sums up the two major surgeries that can be done for anal fissures. In my opinion, again, anal fissure surgery is a last resort, and I kind of leave it that way because of the fact my treatment plan has been so successful at getting people to heal their fissures and allowing them to progress with their life. Definitely continued our journey together as we explore other conditions of proctology or colon and rectal surgery. And I thank you so much for joining me. Thank you very much for commenting and liking my videos. I really appreciate that too. Please subscribe, please ring that bell, and I'll see you next time. Bye-bye.